5 minutes left. All right, remember that when you are just taking her vital signs, just put the blood pressure on her real quick. Listen to her heart and lungs by just being like, okay, now I'm listening to your heart and lungs and your belly. Okay, we're done, right? You don't have to take a lot of time. All right, and timer started. Go. Hello.
Okay, I'm gonna be a nurse today.
Okay.
I'll provide privacy. I wash my hands. I don't see any safety issue. Can I have you verify your full name and date of birth for me?
Yep, it's Anita Baby 21486.
Okay, Anita. Today I'm going to be doing a postpartum assessment on you and the baby.
Okay.
Do you have any question for me?
Nope, I had both a C-section and a vaginal birth because I had twins.
Okay, alrighty. And any safety issue at home and your stay in the hospital?
Nope,
No?
everything's fine.
Okay. So I wanna make sure the bed is in the working height.
Okay.
And Anita, are you eating anything today?
Just a little bit in my bottom.
Okay. And have you gone to the bathroom or empty your bladder?
Yep, just did right now.
You did? Okay. Now I'm just going to do the full set of vitals on you. Gonna check your blood pressure, your temperature, your heart rate, and your respiration. And so we don't need to do this all the way, right?
Okay.
Yeah. So, like that, and I'm going to lay you in a supine position.
Okay.
Do that, and I will check your nipples, your breasts, assess your breasts for any redness, ecchymosis, tenderness, and your nipple. I don't see any crack or bleeding. Do you feel any tenderness when I touch your breast?
Nope.
No? Okay. Now I'm going to auscultate your heart, your lung sign,
Okay.
and also bowel sign.
Okay.
Okay, I'm gonna check your bowel sign, yeah. See your belly. Or full quadrant. Okay. And Anita, I'm going to assess your fundus.
Okay.
For any bleeding or any ecchymosis or any redness or pain. And I feel it's kind of gushy. I'm going to massage until the uterus is firm. And I'm going to wear gloves. Do we actually have to wear gloves?
Mm-hmm.
Check your perineal pad. There's no glove here.
Maybe out. Hang on, press pause real quick. Just keep going. Just keep going.
Wear gloves and check your perineal pad for bleeding, discharge, the color, the quantity, odor. And I see it looks good. I'm going to check your incision site since you had a cesarean birth.
And what is the quantity and characteristic of the lochia on that pad?
It had to be pink and like reddish, not dark blood.
How
Yeah.
much?
It's like 2 centimeters, not much, just a little bleed. And like I said, I check the incision site for edema and swelling, redness, ecchymosis, and I will check your lower extremities for edema, your face, your hands, and have you voided since the delivery?
Yep.
How was that? Do you feel any bladder distension?
Nope.
No. And any concern with emotional status or anything I need to know?
No, I feel pretty good.
Okay. How are you bonding with baby?
Oh, good. I love him to pieces.
Okay. Good. And what else? They check for edema in the face, the lower extremities, and that's for now. Anita, I'm going to do your check on the baby.
Okay.
Wash my hands.
So if it's the baby on the scale that you're gonna do it on.
Okay. Wash my hands, make sure it's the right baby. And Anita, has the baby voided since then?
Yep. It has peed.
That was meconium.
Oh, yep. Has
Yeah.
had that. Yep.
Okay. And as I look at baby appearance, baby skin is pink and moist. I don't see any bruises. I see the face is symmetrical to the body. I'm going to use my pale light and assess baby eyes. The distance from both eyes is 2 to 3 centimeters. I see the scalera is white. That is good. And the pupil is equal, round, and reactive to light. I'm going to measure my baby head. Where's the... We don't have the...
It's right. That little circle thing right next to your pen light. No, the circle thing. There you go. There you go.
So I measure my baby head circumference. So I got 12 centimeter. And do the chest. I measure the chest circumference. Oh, baby. Got 30. And I'll do the length of the baby. The baby length. Got a 5 centimeter. I'm gonna lift my baby up, measure up how the clean pad on the scale. Zero my scale here. And weigh my baby hair facing down. Baby is 1.5 pounds. Lay baby back down. And I'm gonna inspect the ear for the pinna, the cartilage. I see the ear inside is gray and pink. That's good. And I'm gonna check the baby nose for nausea, appendicitis. Include one side. Lift the spine and include the other side. Baby breathing is good. Going to use my glove finger and check the baby mouth for sucking reflex, and also inspect the tongue and the gums. They are pink and moist. I see the tongue move freely side to side, and the baby reflex, the sucking reflex is in tight. And I see the baby neck is round and thick, and you move that side to side, it's flexible. And I'm going to listen to my baby heart rate. Is that one you do?
Yep.
For 1 full minute.
So it's a commercial here. you go. You can start your minute whenever you need.
Okay. Now I'll start. 1, 2, 3, 4, 5, 6, 7, 8. I got 64.
You got 64?
Yeah. So baby heart rate is 64, and I'm going to check the baby. What else? So I'm going to auscultate for bowel sound in all 4 quadrants using the bell of my stethoscope. So, and baby nipple, what's the word? So the hernia is healing, and for the baby, he's a male. I see that he's not circumcised yet. I'm going to wear my glove and palpate the testes in a sequence. See the uterine meatus is male line, and for the female, I'm going to be checking for the edematous labia. The labia majora is larger than the labia minora, and I don't see any discharge, vaginal discharge for the female. I'm going to check the baby reflexes, the Babinski reflex under the feet. I see the baby reacted to that, and the plantar reflex behind the leg, behind the heel, the plateau reflex behind the leg. See, he's reacting to that. Baby got 10 toes equal, 10 fingers equal, and gonna do a range of motion on the baby and do the grasp reflex. See, baby sit up nice and back. I'm gonna check the back of the baby. I don't see any Mongolian spot. I see the baby got a secret dimple at his buttocks, and the back spine is straight, and I don't see any masses. It's midline, and I don't see any ecchymosis, and yes, I did the baby nipple, the fingers, the nails is all pink and even. I don't see any anomalies. And do the reflex on the feet, no edema on baby feet. Baby move arms freely. Baby legs move freely, and I did the mouth, and I don't see any nether teeth in the baby mouth. And baby nipples, I don't see accessory nipples. It's just 2, and it's symmetrical to the body. Yeah. What am I missing?
Did you listen to the heart and lungs?
Yes, I did. For the baby.
Okay. What about the abdomen? What are you looking for?
I was looking for bowel inning, abnormal bowel sign, and I did palpate using my stethoscope. And the umbilical hernia, that's the word. Check is healing. I don't see any drainage. or edema. And check baby the genitalian, check baby genitalian for any edema, ecchymosis, and no Mongolian spot.
Okay, you have 5 minutes left. Are you ready for the gestational assessment, or was there anything else that you'd like to assess?
They check baby nose for petechiae. I don't see any mucus in there. The reflex, the grabs reflex, plantar reflex. I did that. Yeah.
Okay, you ready to come over? Alright, so you don't have to mark anything on this, just do it. Okay, I pressed pause for when you were walking, so, okay, so posture, the posture of this baby, what would you say?
The one with the diaper?
Mm-hmm.
See, 2, no, 3.
Okay, and then for square window, what does that assess? Tell me how you assess that.
The baby hand gotta go like all the way.
Okay, how would you describe this baby's wrist?
That one would be 30. No.
Okay.
That's 0.
And then what is arm recoil? How do I assess it?
Arm recoil, it's not like this, no. It's when your arm is like, oh boy.
How would you describe this baby's arm recoil?
$30.
Which one?
What is that?
So that's square window. This is arm recoil.
Oh, arm recoil. That would be the last one.
Okay.
That's a 90°.
And then what is popliteal angle?
Popliteal angle. It's the one behind the leg.
Okay. What would this popliteal angle be of that?
80.
This one.
That's the leg upright.
So this is his leg. And his knee.
So 140.
Okay. And then scarf sign.
Scarf sign is like this.
Okay. Scarf sign of that baby. This one here.
Yeah, the pictures are kind of confusing.
So you
Taking
this one in this row. Okay.
So you say 1.
Okay. And then heel to ear. How do you do that?
That is their feet is all with to their shoulder. So that would be 2 or 1. Wait. I didn't pay attention to these ones.
The heel to ear? It's just, what picture does this look like to you?
0.
Okay. what skin you would give this baby in the next session.
Galatinous rare
Okay.
translucent.
And then what is lanugo? What is lanugo? What does that word mean? Lanugo.
Oh, when the baby had hair like on the skin.
Okay. How would you describe that?
Mostly a bone
Okay.
the baby.
Okay. How would you end
The entire surface.
How would you end the day? The timer went off. So.
Oh, I will ask the mom. That complete my assessment, Anita. Do you have any question or any concern before I leave your room?
No.
Okay, so I wash my hands, I remove privacy, and before I step out of the room, yes, your call light, your glasses. Do you want a drink of water or anything before I leave? And make sure you call if you need anything.
Okay.
Make sure everything's in reach.
Count some things up here. So, gotta note that it's midline. Make sure that you know what quantity, right, and that the character, right, like what color is it? So it's called Stoughton Scan Rubra. Approximation of the edges, but you know what, you got everything else on there. So this part here, the Sims position. To look at the episiotomy, we didn't do. Right. And then let's see here. You did check you did ask about. Did you ask her if she had a poop? You did the baby.
Yeah.
But then making sure you're looking for her to calf pain, tenderness, that part there, because she could have a clot, right? Looking at the well flex arms and legs, full range of motion. I feel like you did the range of motion here, so I'm gonna count that there. Spontaneous movements, just make sure that we want to be just looking at, you know, how are they when they're just laying there, their general appearance, right? How and when would you take their blood pressure, right? If they have a heart murmur, that's important to note. So you said breast sounds, but you didn't say what we were actually looking for. His heart rate was 160, but you said it was 64, so that was.
So with 1-4 meaning, are you timing about 2?
No.
Right.
You just are doing a heart rate for that full minute. Now, baby's heart rates are really fast, and so his was 160. See, you did that. Good. Looking at, we did Mongolian spots down here. Cyanosis, modeling jaundice. But you did the jaundice.
Yes, I did.
You did that one. For the head, looking at the anterior and posterior fontanelles, did you do that? I liked it there, but I was like, I don't think so.
Yeah, the big friend I didn't.
You looked for the eyes and reflective to light, but masked some of these other reflexes here. Low set ears, that's just a small thing, but it is important to note because it could be a sign of Down syndrome. Did good on the nose, did good on the mouth. Making sure that you are, checking the clavicles because they could have a broken clavicle from birth. So it's not the umbilical hernia that's healing, you're looking for the umbilical cord. We don't want an umbilical hernia. Umbilical hernia is when part of the colon is poking through the abdominal wall. And this is really important to check the vessels.
The 3 cords.
Right, the 3 cords. Look for a dome shaped there. Looking for the xiphoid process. Plus because I gave you a prompt for the abdomen there too. Let's see, 5 there. Did great on these two parts here. Gotta inspect that rectum. You did ask about the meconium though. Couple things here. Peripheral pulses, startle reflex. You did the grasp and the evidence, which is good. You did the folds. Came back to that one, hands fisted. So this means, do they have any fingers that are stuck together or webbed? Okay. And then we ran out of time a little bit on this part here, but lanugo is the hair on the body. So when I asked, I'm not sure about that. Arm recoil is when they're always laying like this, but if I draw their arms down, they spring back up, not out, right? Out would be not good. Popliteal means the knee, so like we're looking at this angle here. Okay, so heel to ear is when so if I was looking at these two pictures, right, and I was looking at popliteal angle, I would say this was a 90, this one is way more than that, right? That's probably like a 120, right? Because that's the angle of the knee. If I was doing heel to ear, I would say this heel, now I'm looking at how close